E-prescribing. What is e-prescribing? E-prescribing, electronic prescribing, refers to the use of electronic systems to create, send, and manage prescriptions for medications. This process involves healthcare professionals, usually doctors, but can also include nurse practitioners and physician assistants, entering prescription information into a digital format, which is then transmitted directly to a pharmacy or healthcare provider. It eliminates the need for handwritten prescriptions, reducing errors and enhancing the overall efficiency of the prescription process. Overview of electronic prescription systems. An electronic prescription system typically consists of three key components. Prescription creation. The healthcare provider inputs prescription details, medication name, dosage, quantity, instructions, into a secure software platform. This step can be integrated with the patient's electronic health records, EHR, which further streamlines the process and helps in reviewing a patient's medical history, allergies, and other medications. Prescription transmission. Once the prescription is completed, it is transmitted electronically to the pharmacy. This can be done in real time, allowing pharmacies to prepare the medication quickly. Electronic transmission ensures accuracy and security, with fewer risks of misinterpretation or loss. Prescription fulfillment. After receiving the electronic prescription, the pharmacy processes it and prepares the medication as instructed. Some systems allow for tracking and updates on the status of the prescription, enabling patients to be notified when their medication is ready for pickup or delivery. Benefits of e-prescribing. Increased safety. Reduces medication errors caused by illegible handwriting, miscommunication, or incorrect dosage information. Improved efficiency. Speeds up the prescription process, allowing for quicker fulfillment and reduced wait times for patients. Cost reduction. Minimizes the risk of costly medication errors and unnecessary refills. Better patient outcomes. Allows for better monitoring and tracking of prescriptions, reducing the chances of drug interactions and improving patient care. The evolution of e-prescribing in modern healthcare. E-prescribing has undergone significant advancements over the past few decades, evolving from simple digital documentation systems to sophisticated integrated platforms that play a vital role in modern healthcare. This evolution has been driven by technological innovations, policy changes, and the need for improved patient safety, efficiency, and healthcare outcomes. 1. Early days. Paper-based to digital transition. Before the advent of e-prescribing, healthcare providers relied on handwritten prescriptions, which were prone to errors due to illegibility, miscommunication, or misunderstanding of drug instructions. The introduction of electronic health records, EHR, in the late 1990s paved the way for the digitization of prescription management. First steps, 1990s. Initial attempts at electronic prescribing began as part of broader initiatives to automate healthcare records. Early e-prescribing systems were largely used for internal purposes within hospital systems, where prescriptions were typed into basic computer systems, replacing handwritten scripts with digital forms. Challenges. During this period, the systems were standalone and not yet connected to other healthcare systems, limiting their effectiveness and efficiency. There were also concerns about the high cost of transitioning from paper-based systems to digital solutions. 2. Advancement and integration, early 2000s. By the early 2000s, e-prescribing began to gain traction as more healthcare facilities adopted electronic health record systems. However, integration between different systems, such as pharmacies, insurance companies, and hospitals, was still a challenge. Adoption of EHRs. As electronic health records, EHRs, became more widespread, e-prescribing became a natural extension. healthcare providers began to use e-prescribing within EHR systems to directly input prescription data, reducing manual entry errors. Regulatory push. The U.S. government, through initiatives like the Health Information Technology for Economic and Clinical Health (HITECH) Act of 2009, began incentivizing the use of e-prescribing by offering financial incentives for providers who demonstrated meaningful use of EHR systems. This spurred broader adoption across the healthcare sector. 3. Mainstream adoption and interoperability. 2010s. The 2010s saw significant advancements in the capabilities of e-prescribing systems, driven by improvements in software design, cloud computing, and healthcare interoperability standards. Increased interoperability. One of the key developments during this period was the push for interoperability, ensuring that e-prescribing systems could easily communicate with pharmacies, insurers, and other healthcare entities. This was made possible by the adoption of standardized messaging protocols such as HL7, Health Level 7, and NCPDP, National Council for Prescription Drug Programs. Drug and drug allergy. Checking with the integration of decision support systems, modern e-prescribing tools began to include built-in checks for potential drug-drug interactions, allergies, and dosage errors, significantly reducing medication errors and enhancing patient safety. Government mandates. In the U.S., the Medicare Modernization Act, MMA, of 2003 and the Affordable Care Act, ACA, of 2010 mandated the adoption of electronic prescribing as part of broader efforts to streamline healthcare administration and improve patient safety. Fourth, modern-day, smart and secure e-prescribing systems. Today, e-prescribing is an integral component of modern healthcare, with advanced systems that are not only used to prescribe medications, but also play an essential role in the overall care process. Cloud-based systems and mobile integration. Many e-prescribing systems are now cloud-based, making them more accessible and secure. Providers can send prescriptions directly to pharmacies from any location, improving convenience and accessibility. Mobile apps and platforms also allow patients to receive digital prescriptions directly, with the option to manage medication refills or receive reminders. Telemedicine integration. The rise of telemedicine, particularly accelerated during the COVID-19 pandemic, has further enhanced the utility of e-prescribing. Healthcare providers conducting virtual consultations can seamlessly prescribe medications electronically, facilitating better care in remote settings. Controlled substances and security. The management of controlled substances has become more sophisticated with e-prescribing. Systems now include enhanced verification features, ensuring that prescriptions for narcotics and other controlled drugs are secure, reducing the risk of fraud or misuse. Global adoption. While e-prescribing initially saw wide adoption in countries like the U.S., it has become increasingly global, with countries such as Canada, the UK, and several European nations implementing or enhancing their own electronic prescribing frameworks. 5. Looking ahead. The future of e-prescribing. The future of e-prescribing is focused on increasing interoperability, improving patient engagement, and ensuring more seamless integration with other digital health technologies. Artificial intelligence, AI, and machine learning, ML. Future e-prescribing systems may incorporate AI and ML to provide more personalized recommendations, predict medication needs, and identify potential risks more accurately. Patient-centered prescriptions. With increasing patient access to healthcare data, patients may have more control over their prescriptions, choosing pharmacies or managing medication plans with better transparency and choice. Blockchain for security. Blockchain technology may further enhance the security and transparency of e-prescriptions, particularly in preventing fraud and ensuring patient privacy. The e-prescribing workflow, understanding the end-to-end process. E-prescribing is a streamlined process that improves medication safety and efficiency. The workflow of e-prescribing encompasses several key steps, from prescription creation to transmission and fulfillment at the pharmacy. Understanding this process helps ensure smooth operations and better healthcare outcomes for patients. 1. Prescription creation. The first step in the e-prescribing workflow is the creation of the prescription by the healthcare provider, doctor, nurse practitioner, etc. Electronic health record, EHR. Integration. The provider uses an EHR system or an e-prescribing software integrated with the patient's medical records. This system allows the provider to review the patient's medical history, allergies, current medications, and potential drug interactions before prescribing new medication. Medication selection. The provider selects the appropriate medication, dosage, quantity, and instructions from a drug database within the e-prescribing system. Some systems offer automated recommendations based on clinical guidelines or previous patient data, ensuring safer and more accurate prescriptions. Clinical decision support. Built-in tools within the EHR or e-prescribing platform check for potential medication interactions, allergies, and dosage errors, reducing the chances of adverse events and promoting patient safety. Review and approval. After entering the medication information, the provider reviews the prescription details and ensures they are accurate. The provider may consult with the patient about options for medications or treatments at this stage.